Hello, and welcome to another episode of The Power You Have. I'm your host, Congresswoman Pramila Jayapal, and I am so thrilled to be with you today. For those of you who are new, this podcast digs into how each one of us can harness the power that we have, whether that's in our jobs, our communities, as organizers, or advocates, how each of us have power that we can use and build in our day-to-day lives. How each of us can turn our fear and anger into action and progress. For the next few episodes, we're going to be honing in on an issue that I know so many of us feel helpless about when we have to confront it, and that is the American healthcare system. It is a daunting web of red tape, long waits, prior authorizations, all coming together to make our lives incredibly expensive. And why? Just so that the pockets of a few big pharma and big insurance CEOs can get padded with gold and our pain. For too many people, their pain is actually corporate profit. It is criminal that in the richest country in the world, 85 million people are uninsured or underinsured. It is criminal that in the richest country in the world, 100 million Americans have medical debt that totals $220 billion. And it is criminal that even as more and more Americans suffer and die because they can't get the health care they need, the 5 largest private insurance companies had $371 billion in profits in the last decade, all by denying your healthcare claims and raising prices for essential healthcare that people need. Right now, these same private insurance companies are doing everything they can to privatize Medicare through programs like Medicare Disadvantage, an effort that is supported by the Trump administration. It's actually called Medicare Advantage plans, but I call it Medicare Disadvantage because it is not good for the people that take these plans. This is all happening as Republicans strip healthcare from millions of Americans. And I want to share one story from a constituent who wrote to my office. Here's what she said. I am 57 years old and self-employed with an income of around $50,000. I am in very good health and I rarely go to the doctor. But with the expiration of the ACA enhanced premium tax credits, I will be paying $10,848 for health insurance premiums next year. That's around 22% of my income. And this is for a plan with a $6,500 deductible. I am not sure how it can responsibly be called, quote, insurance when I'm paying over $17,000 before the insurance even kicks in. If the enhanced premium tax credits had been extended, my premium rates would have been capped at 8.5% of my income, or around $4,250. The expiration of this credit means a tax increase for me of more than $6,600 next year. Here's the thing. We do need to extend these tax credits to ensure that people can afford health care so that people like my constituent aren't struggling. But I also want to be real about the fact that the current healthcare system has been completely exploited by these private for-profit insurance companies and pharmaceutical companies. They are now taking profit from every part of the system, charging enormous amounts of premiums, copays, and deductibles, requiring pre-authorization of your medical needs by installing their doctors to override what your doctor says is necessary, and limiting your choice of doctors by putting more and more doctors out of network. Now they're even buying up clinics and vertically integrating their operations so they can charge you more at every single level. We desperately need to build a completely different system. And we need to stop tinkering around the edges with the sick care system we have. The good news is that we already have a system that is incredibly popular, provides great care, and costs way less than private insurance companies charge. It's called Medicare, and it exists for people over 65. In Medicare, the government, not private for-profit insurance companies, provides the insurance card, saving you huge amounts of money that is not going to pad the pockets of insurance CEOs. It's able to negotiate far better rates, and it can provide comprehensive care. So I've introduced a bill along with Senator Bernie Sanders called Medicare for All. My bill expands Medicare to cover all the health care you need, from dental, vision, and hearing to reproductive care, and to make it available to every single person from birth to death. This is the kind of real structural change that will guarantee every single American health care coverage. And Medicare for All is not a crazy radical idea. The government providing your insurance card so that private for-profit companies can't bilk and swindle you is actually what every other wealthy nation in the world already does. And providing healthcare that actually covers the things you need, like covers your eyes, ears, and teeth, shouldn't be a controversial thing. What you have to know is that we are up against these giant insurance companies that have tons of money, and they're going to do everything they can to squash any changes to the current system, including by lying to you, because they're doing just fine and they don't want anything to change. Now, just think about this. In 2024, United Health Group raked in $400 billion. Their CEO, Andrew Whitty, received $26.3 million in 2024. And in the same year, their PAC, which is their Political Action Committee, gave hundreds of thousands of dollars both to Democrats and Republicans to keep the system exactly as it is. And we see similar numbers across health insurance corporations. Blue Cross Blue Shield, Aetna, Cigna, all of these corporations raked in billions of dollars in profits as the people that they insure struggled to pay premiums and copays. Despite all the money that private insurance lobbies and big pharma put into fighting this idea, the truth is that Medicare for All is still incredibly popular, supported by 70% of registered voters, endorsed by over 100 local governments across the country. So, what does Medicare for All actually mean? Just imagine not having to pay copays, private insurance premiums, or deductibles. Imagine not losing your health care when you lose your job, because health care is not tied to a single job. Imagine being able to start a small business or a different job and not worrying about where you're going to get your health care. Imagine not having to bargain over health care when you also need more salary. Imagine not having to fight with your private insurance company to get the care that you need. Imagine no more GoFundMe accounts to pay for your illness, no more sleepless nights wondering if you should pay rent or go get the surgery you need, no more waiting until you are 65 and on Medicare to finally get your cancer diagnosed. No more ignoring your teeth, ears, and eyes because you don't have coverage for those critical parts of your body. That's how my expanded Medicare for All bill is designed. It builds upon and expands Medicare to provide comprehensive benefits to every person in the United States, from primary care to vision and dental, prescription drugs, mental health, substance abuse, long-term services and supports, and reproductive health care. The Medicare for All Act of 2025 also includes universal coverage of long-term care with no cost sharing for older Americans and individuals with disabilities, and it prioritizes home and community-based care. Additionally, patients have the freedom to choose the doctors, hospitals, and other providers they want to see without worrying about whether a provider is in network. The legislation also streamlines the healthcare system to negotiate drug prices and reduce massive administrative waste in the system. It does all of these things, ensuring that you have health coverage without breaking the bank. And so now, as my guest today, I want to bring in someone who has a really unique view of the healthcare system and has been leading the charge for change to advocate for Medicare for All. Wendell Potter's career in communications spans more than 4 decades, half of which he spent as a communications and public affairs executive for major private health insurers, Humana and Cigna. After witnessing firsthand how these corporations use strategic PR and lobbying to tilt the scales towards corporate interests instead of patients, Wendell abandoned that corporate career and actually went on to advocate for meaningful healthcare reform. In 2009, Wendell appeared before Congress to offer his expert testimony on health insurance in the United States. He pulled the curtain back to reveal business practices and propaganda tactics that contribute to spiraling healthcare costs and the growing number of uninsured and underinsured Americans. Wendell leads the nonprofit Center for Health and Democracy and the Lower Out of Pockets Now Coalition, an organization that advocates for health insurance that doesn't leave families buried under mountains of medical debt. No one understands better than Wendell how a few insurance companies have grown to gargantuan size, how they continue to mislead all of us, including our employers and the people we vote for, and how they spend huge sums of our taxes and premium dollars to enrich their executives and shareholders. I'm so grateful to have Wendell Potter here today for this conversation. And here he is, Wendell Potter. Thank you so much, Wendell, for joining us on The Power You Have.
Congresswoman, it's great to be on the podcast. Thank you so much for this opportunity.
Well, you're such an expert on this issue of healthcare, and you have such a unique background. I've given a little bit of your bio, of course, but I want to start just by asking you to tell people a little bit about your journey. You used to be an executive for the healthcare industry, for a private insurance company. Then you left and you became one of our country's leading advocates for major reforms to the healthcare system. So tell the people that are listening a little bit about your story and kind of why you ended up where you ended up.
Well, thank you. I did work inside the belly of the beast, I guess you would say. I worked for Humana and Cigna all together for about 20 years, and I was vice president of corporate communications for Cigna when I left the industry after what I've sometimes described as a crisis of conscience. In that role, I handled financial communications to the media. I also worked very closely with our lobbyists in Washington and the states to equip them with talking points, to promote the industry's objectives over the years. And they included moving people as rapidly as possible into high deductible plans. That was one of the reasons why I decided to leave, because I knew that these were going to be a big problem for many, if not most, American families, and we're seeing that that's the case today. I think I left, there are two or three reasons. One is because among the other things that I did was handle what we referred to as high-profile cases when the company would refuse to pay for someone's necessary care. And we had many of those calls from reporters all over the country. And one of them in particular was, I've often said it was the camel, the straw that broke the camel's back, involving a 17-year-old girl in California who needed a liver transplant urgently, and Cigna refused to pay for it. This was an example of prior authorization, which Congress is still and maybe seriously considering doing something about. But Cigna refused to pay for it. The family decided that they would do what they could to get Cigna to change their mind, and it became a very highly publicized case. So much so that Cigna eventually agreed to cover it, but it came too late. These delays often can be deadly, and you may know that during the debate on what became the Affordable Care Act, we heard a lot of opponents say that what that legislation would do would be creating death panels. It was not true at that time, but what people don't recognize is that these companies, frankly, maintain death panels. By using prior authorization, they are able to make sure that people do not get the care that they need, that their doctors know that they need. And when Cigna finally agreed to cover Natalie Sarkeesian's transplant, the family was overjoyed, but sadly it came too late, and Natalie died just about 5 hours after Cigna said,
my goodness.
Transplant. That happens every single day, and I'd handled so many of these over the years, I just didn't have it in me to handle any more. I also came from a working class family. I also knew, as I'd mentioned, that these high deductible plans would be bad for so many American families. I earlier that same year attended something called a remote area medical clinic not too far from where I grew up in Tennessee. And I saw people who were standing in lines waiting to get care in barns and animal stalls. These were people who, many cases, were uninsured, but many of them were underinsured. They had coverage, they were paying premiums, but still couldn't afford their deductibles. And I realized that I was doing work that was perpetuating a system that was failing so many Americans, including people I could have grown up with. And I made a commitment that I would find some other way to earn a living. So I did, and decided not only to leave that career, but to become an advocate for reform.
Which is kind of amazing because there are a lot of people who may say, I'm not going to do this work anymore. I see the harm that it's causing. But it's a whole nother thing to kind of then make it your business to call out that previous employer, and with a tremendous amount of knowledge of exactly what's happening. I mean, you saw the prospectuses, you saw the financial statements, you saw where the money was being made. And even since I've come into Congress 9 years now, things have gotten just so much worse. And even some of the protections that were put into the Affordable Care Act have been undermined substantially. These insurance companies have figured out a way to get around it. Drug companies, of course, making huge amounts of money. And I was wondering if you could talk a little bit about sort of what's happening right now with these private for-profit insurance companies, how they're making money off of people's pain and sickness, and why a system that relies on private insurers. You and I did a panel together, or we had you in for a panel a couple of months ago, and I remember there was a question for you about where do you start? Because there's a lot of corruption throughout the healthcare system. And I do recall you saying that while there are a lot of places to start, these private insurance companies are perhaps the worst offenders. So I was wondering if you could talk a little bit about what are the things that they're doing that rip off people getting the healthcare that they need?
In so many ways, they're ripping people off. One is charging excessive premiums, and over the years, premiums have gone up so much that many families just simply cannot afford coverage. We're seeing an increase once again in the number of uninsured Americans. Of course, the Trump administration is adding to that by cutting back funding for the Medicaid program. They're also fleecing employers. These companies serve as third-party administrators for employers that offer subsidized coverage to their workers, and they're making a lot of money by charging excessive fees, often hidden fees. But they're also making people pay a lot of money out of their own pockets before their coverage kicks in. This goes back to the conversation about high deductible plans.
Deductibles.
And the Affordable Care Act put a limit on that, but the limit is absurdly high. It's going up to about $21,000 next year for a family, which is just unaffordable for most American families. So that means that people, even if they have insurance, even if they're paying premiums and sometimes getting subsidies from the government or from an employer, they're still not able to use that coverage because they just don't have enough money in their bank accounts to spend what they have to spend before their coverage kicks in. So we're seeing that people are going without care. And also, as we also noted, they're making aggressive use of prior authorization, of refusing to pay for medically necessary care. And I saw this coming, and it's one of the reasons, as I said, that I left. People are not getting the care that they need, and this prior authorization is a big burden for doctors, for hospitals, and it decreases our administrative expenses. They have to have people on staff who do nothing more day in and day out than try to make sure that they're able to treat their patients, get coverage for their treatment. But also, Congresswoman, they have figured out how to game the federal programs. They have gotten deeply into Medicare Advantage to the point that
I call it Medicare Disadvantage, as because it really is. It's privatization of the Medicare system.
It is. It is. And also the Medicaid program, as I'll explain. The Medicare Advantage program or Medicare Disadvantage has certainly been an advantage for them, but not for so many people who are lured into these plans, not knowing what the side effects are, if you will, what the downsides are. They're able to advertise as if the people will get additional benefits. Often they're pretty skimpy additional benefits, but they're just like commercial plans, very much unlike traditional Medicare, which does not, for the most part, even use prior authorization, except for a very small number of situations. And there are no networks. People can, if they're in traditional Medicare or original Medicare, can see any doctor or hospital that participates, and almost all do. In Medicare Disadvantage, they all maintain proprietary networks, and they change them every year. And in many cases, they have ghost networks saying that a doctor or hospital is in network, and they really are not. They can be on the hook for thousands of dollars if they knowingly or inadvertently go out of network for care. And they may not get care at all, even though it's a covered benefit because of the use of prior authorization. And it's been such a cash cow for these big companies that, for example, United Health Group, United Healthcare is the biggest player in Medicare Advantage, but it's also a big player in the Medicaid program. And that company now gets more than 75% of its revenue, United Healthcare, from government programs, from primarily from Medicare Advantage and from the Medicaid program. That just shows you how much they're ripping taxpayers off, and they've gamed it to get overpayments. It's been estimated by MedPAC and other researchers that these companies are overpaid this year alone about $84 billion in overpayment.
And you did an amazing report that we're going to talk about. And all of this money that they're getting then goes into the pockets of the CEOs, the top executives. So it's a multiple whammy situation where people are paying enormous amounts, whether it's premiums, deductibles, copays, all the different ways in which they pay for this. Some people don't always know how much they spend, right, Wendell? Because some of it, maybe they go to a doctor's office, they pay $25 for a copay, then they've got their deductible amount, and they don't always know. And we have a calculator that we developed that we'll put into the chat so people can check it out, where you can find out how much you pay for all these things, and you can figure out how much a Medicare for All system would save you. But also, I think what's interesting is, you're talking about prior authorization. This is essentially where they have to approve what your doctor has said you need. You have to go to somebody else's doctor. So these are doctors that are paid by these insurance companies. They can just say, no, I'm overriding your doctor. That procedure is not covered. Yes. Another way of denying care. And the other thing you mentioned is, the in-network care. This is also such a hypocrisy for me because at least 5 years ago, one of the big arguments against Medicare for All used to be that you're not going to have choice. You're not going to be able to see the doctor you want. But in fact, that's the case right now with these private insurance plans. You can't see, unlike traditional Medicare, you have to stay with certain doctors, certain hospitals, and if you get sick somewhere and you happen to go to a hospital that's not in that network, you could be liable for tens of thousands of dollars that you didn't know. You thought you were covered for that procedure, but that's not the case. And so I think you're right. They really have figured out how to game the system and make as much money as they can, which then goes to a few CEOs and top management. And meanwhile, more and more people are uninsured or underinsured. And underinsured, just for anyone who's listening, is a term we use when you have healthcare and yet you're still not covered for the healthcare you need. So maybe your employer starts a GoFundMe account for you. Maybe your family, has to chip in. Those are all the ways that people are underinsured. I want to ask you a question about the ways in which these private insurance companies are now also acquiring clinics. So they're not just insuring, providing health insurance, they're also providing the actual service by buying up clinics, right? And vertically integrating.
That's exactly right. It is vertical integration, and during most of the years that I was in the industry, they were engaged in horizontal integration, which means that the companies were buying smaller competitors. They were getting to be very big, and when I worked for Cigna, it was at that time a very big company. It is massively bigger now than it was before. So is United Healthcare. CVS now owns Aetna. United Health Group is again the largest, but Cigna has gotten into, especially into the pharmacy benefit business. It's largely a drug company that is a middleman in the pharmacy supply chain that also has an insurance company. And United is the largest employer of doctors in the country, and it has acquired hundreds of physician practices. Most people don't even know that United owns them because they have different branding. But it is another way for them to capture our money. And even if you are not enrolled in the United Healthcare plan, you still are spending money with them. It's almost unavoidable, either as a taxpayer because of all they're getting from the public programs, but also you can go to their clinics and not know that they're owned by United, and you're giving them money that way. The company they account for this by calling it intercompany elimination, and what that means is that the insurance arm of the company is paying itself, steering its health plan members into entities that it owns. The clinics, the physician practices, the pharmacy benefit managers, and almost a third of what United Healthcare takes in, it now pays itself. And that is certainly circumventing an important provision of the Affordable Care Act. They figured out how to game that law in particular.
So this is part of the report that you were mentioning that you just released. I think that some of this information is in there, an incredible report called the Sunlight Report. And it looks at the enormous monopolistic conglomerate that United Healthcare has become. And it found that United Health Group is composed of, let me see if I get this number right, 2,694 subsidiaries.
That's right, almost 2,700 subsidiaries. And that was a snapshot in time. It could very well be considerably more than that right now. And they don't even make a public disclosure to the SEC for most of these acquisitions. It took a lot of research over quite a bit of time to put that together, but it is one of the biggest corporations on the planet, and it has become the third biggest company in America by revenue. The only companies that are bigger are Amazon and Walmart when it comes to revenue.
So what does that mean for, we have a lot of listeners who may not totally understand the healthcare system in the way that you and I have spent a lot of time diving into it. What does that mean for people? I mean, what should they be on the lookout for? What else did you uncover in this report that you want people to know about?
Well, that company in particular, and it's not just that company. The other companies have integrated in a similar way, but this company's just done it kind of on steroids. They capture money from us cradle to grave. They've also gotten into the home health business, the hospice business even. So there is no way in America that you can avoid in one way or another at some point in your life funding that company. And you're exactly right. Much of the money that we pay winds up in the pockets of the CEO and other top executives, and they are New York Stock Exchange traded companies. So they're under constant pressure from their investors, and they're largely big institutional investors that are demanding that they spend less and less of premium dollars on our care. And that's because the more money they take in, the more money they have to reward their shareholders. United alone made over $30 billion in profits last year.
That's incredible.
And much of that is because of the way that they do business, this vertical integration that we're talking about. And Wall Street, though, they're never satisfied. They're always
They
In
always want you to grow and earn more and bring in more for the shareholders. Yeah.
That's exactly right, and that means that they will make even more aggressive use of prior authorization. They will reduce and they've even announced on on the earnings call that they're going to reduce the size of the networks, which means people will have even less choice than they have now. That, by the way, is what people really care about: is having a choice of doctors and hospitals, of people who actually provide care, not health insurance companies. But they've so confused in many cases and lied to the American public that people think that Medicare for all, for example, would take choice away when it would actually
Give you
benefit them
choice.
and give them choice that
Yeah.
they care about.
Yep. And we're really seeing that happen. In fact, my colleague Shamari Figures, who represents a district in Alabama, he recently got on my Medicare for All bill as a co-sponsor, and I was surprised because I hadn't even talked to him about it. And usually I have to explain the bill and people have to come on. And so I went up to him and said, "Hey, Shamari, I saw that you got on the bill. That's fantastic. Tell me why." And he said, "Pramila, healthcare in Alabama has absolutely collapsed. There is no healthcare in Alabama that, unless you're willing to drive 3 hours to get to a hospital, our rural hospitals are shut down." And of course, this was already starting to happen. The big bad betrayal bill cutting $1 trillion from Medicaid, and then, not extending the Affordable Care Act subsidies, which I'm very much in favor of extending. But I will say that the way we bring healthcare costs down in this country for people is by giving subsidies to those very private insurance companies who keep raising the premiums, and both on employers and on the federal government. As you pointed out, so much of their revenue comes from the federal government. So we need a different system. And I want to get to that, but I did want to just ask you one more question about Medicare Disadvantage, because I'm so focused on this. I have so many constituents who come to me and say, "I got tricked. I ended up thinking that I was going to get more from Medicare Disadvantage. It was advertised on TV. I thought it was Medicare because it uses the word Medicare. And now I can't get off of it and they won't give me my care." So tell people that might be thinking about getting on a Medicare Advantage plan, or Medicare Disadvantage plan, as I call it, what they really should be aware of when they're making that choice to get off of traditional Medicare and onto a Medicare Disadvantage plan.
They need to know that it can be very, very difficult for them to go to traditional Medicare or go back to traditional Medicare after they've enrolled in Medicare Advantage. Sadly, fortunately for people who enroll in traditional Medicare, when they become eligible during the first 6 months, you don't have to go through underwriting to get a Medicare supplement policy, which is important because we want to not only expand but improve the Medicare program.
Absolutely.
And one of the shortcomings is that people can often have to pay pretty significant out-of-pocket costs. And that's where these companies really mislead people. People can also be on the hook for a lot of money if they see a doctor or hospital out of network. And they also can find out, as we said, that they have ever shrinking provider networks. And so people need to know that you could be trapped in a Medicare Advantage plan, and that you can go back, but you may have to go through medical underwriting, which means that the cost of a Medigap policy can be significantly more. People also need to know that often they advertise these as zero cost or zero premium plans. That's nonsense. Very few really are. People still have to pay their Part B premium. So their ads are always deceptive.
So misleading, and we had to do a lot of work on behalf of several constituents to get them back onto traditional Medicare, as you said, after they had been denied care that they would have gotten if they had stayed on traditional Medicare, and they were told because of prior authorization, other things, that they were not eligible for that care under Medicare Disadvantage. Well, let's move to solutions, because my favorite policy that I came into Congress fighting for, and I still am. I'm the lead sponsor of the Medicare for All bill. This is a universal It's sometimes called single payer for people who are listening and aren't familiar with that. It just means that the government provides your insurance card. So that's the case with Medicare. That's how people get on Medicare. When you're 65, you're eligible for Medicare. The government is essentially doing your insurance, and then you can go see whatever doctor or hospital you want to see. And there are problems with Medicare. We've been trying to expand Medicare to include dental, vision, and hearing as an example. That's part of the reason Medicare Disadvantage plans started to spring up, because they were offering benefits that Medicare didn't have. So in our Medicare for All bill, it's an expanded Medicare bill that covers comprehensive care, including long-term care. And it's a universal bill for everybody from birth to death. So tell us how you see Medicare for All. How would you explain it to the people who are listening? Why do you think it's important to transform healthcare as we know it?
Well, for so many reasons, it makes so much sense for this country. Which by the way, is the only developed country that doesn't have universal coverage. And we spend more than twice on average per person on healthcare in this country as the average of other developed countries. But we get so little for all that we're spending, and in many cases, people go uninsured or they are underinsured. So this is a means of bringing everyone into coverage and being able to have choice of providers, which we know is what people really care about. When I say providers, I'm talking about doctors and hospitals and clinics, almost all of which participate in traditional Medicare. So it's very cost effective. It has very low administrative cost. Private insurance, because of prior authorization, because of the need to make a profit and to have such high overhead, about 30% of what we spend on the private side of our healthcare system goes to administrative costs. That's unknown in other countries, and there's so much fraud, waste, and abuse in that system. And it's also would be beneficial to employers too. Next year, the cost of the family premium will probably be about $27,000.
Yeah.
And employers subsidize it, or at least the largest ones do. People don't realize that about half of employers no longer can afford to offer subsidized benefits because these premiums go up every year, and they just throw in the towel. That's why the ACA, the marketplace, was important, because it at least was a place where people could get coverage if they don't have employer-sponsored care.
Right.
But there's so many reasons why your legislation makes sense, and it does provide the choice that we care about. It would save us all a lot of money. That includes our employers, and we wouldn't be rewarding shareholders as we are now, so much of our hard-earned money.
There's a lot of people who say that, well, Medicare for All in theory sounds great, but it's going to cost us way more than we pay right now. I have an answer to that, but I'd love to hear yours.
Well, there's enough money in the system that we spend well over $5 trillion a year now
Right.
on healthcare. That's far more than enough
Right.
to cover everyone and make sure everyone gets good
Far
quality.
more per capita than any other country that actually provides health care and covers
Exactly.
everybody.
Exactly. So it can be done economically. It just eliminates this administrative waste, and it's so affordable, and and I think increasingly we're seeing doctors embrace the idea of Medicare for All, because they are seeing how they are being taken advantage of,
Yeah.
and to their disadvantage, to use that word again, of whether we're talking about a commercial plan or Medicare Advantage plan, even Medicaid, because these companies have largely taken over the Medicaid program. So we can get these companies out of our healthcare system in a way that would make sure that we have everyone covered, everyone having access to quality care, no prior authorization. So it's a no-brainer. But my old industry, and I was a part of this. They're experts when it comes to propaganda and misleading people. So that's what we're up against.
That's
But
what we're up against. Exactly. And the other thing that they often say, it used to be no choice. They're having a harder time saying that because they have so many limitations now on their own networks. But the other thing they say is, oh, it means you won't be able to get care. You're going to have to wait in these long lines, because you won't be able to get the care. And I remind people that just like your patient that you described at the beginning who needed was it a liver transplant? Um, she had to wait a long time, too long, and she ended up dying. And we have so many people who are either uninsured or underinsured in this country. Tens of millions of people. I think the number is 80 million now, depending on which ones you look at. So imagine all these people that simply don't get care. But in addition, even if you have um, private health insurance covered by your employer, covered by whomever, the wait times right now are often extremely long just to
yeah,
get a specialist, for example.
it's true. You can wait months to see a specialist, and I know because we used to point when I was in the industry, point to Canada as an example, and
That's the one that always comes up. Yep.
it is, and try to make the case that people in Canada have to wait for months for necessary care. It's not true. It is not true at all. People have very quick access to necessary care, so into primary care.
Yeah.
Uh, but in this country, we can wait months and months and months for care that we need. And for folks who are underinsured, another term for that is functionally uninsured. They may have an insurance card, but they can't use it. We should not put up with that any
We
longer.
should not. That's right. Absolutely right. Wendell, it's open enrollment season. This is the time when Americans can sign up for either a change or to cancel a health insurance plan. What should people know right now as they consider their options, especially with Trump and Republicans choosing to increase health insurance premiums for millions of families this year?
Yeah, it's the administration and Republicans in Congress have really put a lot of people's health in peril and
Yeah.
their finances in peril,
Yeah.
because as we both agree that subsidies are necessary for people to get their coverage, whether it's from an employer or from the government, because coverage is just too expensive.
It's too
Uh,
expensive.
and not only are the costs going up, but the value of the coverage from these companies goes down every year. But we really need to make sure that we have coverage, even with the expense. If you can afford it at all, try to enroll in a plan, whether it's through your employer. But the Trump administration, because it has chosen and Congress to not extend those subsidies, sadly, a lot of people are going to look at what they have to pay not only out of pocket, but for their premiums. And I think we're going to see an uptick, a significant increase.
People are going to make a choice to not get health insurance because, and I've already had some constituents say this to me, but I think you're right. If at all possible, try to get a health insurance plan right now. But I know it's tough for people who are making choices between rent and healthcare. That's an absurd and ridiculous choice.
It is.
One last question. This podcast is called The Power You Have. And we try to inspire people to both understand what a situation is, what an issue is, but also to take action. And you're kind of an amazing organizer. You have done so much to kind of build support, do advocacy, research around the healthcare system and the changes we need to make. What advice do you have for people who are listening and who are saying, I can't afford my healthcare. I want to make a difference. What can I do right now that can help make a difference? It can help build a movement for a universal healthcare program that makes sure everyone's got healthcare.
Well, get politically involved, for one thing, and get to know your member of Congress and staff. Now, it's not only important for them to know who you are, and who your colleagues are, but for you to know who they are. Get involved with advocacy organizations that are advocating for transformative change in our healthcare system. I lead an organization called the Center for Health and Democracy. We also convene a lot of other organizations, and that's part of, I think, the reason for our success is that we work collaboratively with other groups as well too, and we encourage people to get involved at the local level, and nothing is too small for someone to do. If you can contribute financially, that's great. But write letters to the editor of your local newspaper if you still have one. But just get involved and reach out to us at the Center for Health and Democracy. We also publish a newsletter called Healthcare Uncovered, which exists to help people become more aware and to understand our healthcare system and its many flaws and what we can do about it. So get as well educated as you can. It's an enormously complex system, as you know, and we try to help people understand it in ways that we hope is accessible.
Well, that's fantastic. And if people want to access that report that you did and your organization, what's the website?
Well, centerforhealthanddemocracy.org is our website. You can also, Sunlight Report United Health Group, I think, is the website for the report itself, but you can also find it at the Center for Health and Democracy. And we've written about it extensively at our newsletter, which is healthcareuncovered.substack.com. Check out our work and look at that report. I think will be eye-opening. It has been for so many policymakers. We've had conversations with attorneys general, with Republicans in Congress as well too, who have found this to be pretty eye-opening for them as well.
Yeah, I think this is one of those areas that could break open. And, much as there's many things I don't agree with Marjorie Taylor Greene on, she at least started talking about how we need to reform the healthcare system. Now, maybe our ideas are different, but I am going to reach out to her, about Medicare for All and start talking about it. I think for everyone that's out here, we're going to do a lot more on this topic of healthcare, breakdown for you exactly how a Medicare for All system would work. This is not crazy, radical thinking. This is what every other wealthy country in the world has, that you don't have to worry about losing your health care when you lose your job. You don't have to constantly feel like you're one crisis away, medical emergency away from bankruptcy. That is not how we in the richest country in the world should live. And we are so fortunate to have people like Wendell Potter with us and doing the work that you are doing, Wendell. Thank you so much for joining The Power You Have.
Thank you, Congresswoman. We're fortunate to have you, and thank you for your leadership in this area.
And that is a wrap for this week's episode of The Power You Have. Thank you so much for listening. And if you haven't already, be sure to check out the full video recordings of all our conversations on my YouTube channel @RepJayapal, and subscribe to our show wherever you get your podcasts. Until next time, keep resisting, stay engaged, and remember to use the power you have.